we're working on gait training with a kid with cerebral palsy, and they would only walk if we played Taylor Swift. And I was like, this is my place. This is where I belong. Like,
I belong in this setting. Yeah.
Yes. So that was why I chose it. And I feel like I've been on pediatric physical therapy for a long time now.
Yeah. And I think Taylor Swift would be happy to know that she's getting people moving.
Yes. She's an inspiration.
Hey everybody, welcome back to another episode of Therapy Unmasked. Today, I am joined with Nick, obviously, and one of our physical therapists here at the clinic. She primarily works at our Ogden clinic, but she's here like once a week in Layton. Morgan, you want to say hi to everyone, Morgan?
Hello, everyone.
Nice to see you again, Morgan. I get to see you a lot, but tell us a little bit about yourself.
I am originally from Virginia, so kind of made the cross-country trek in July. Just graduated from PT school in May of 2024. I enjoy lots of things. I enjoy reading, I enjoy hockey, and just getting to spend time with my friends and family. That's kind of my elevator pitch of a self.
There you go.
What brought you out here to Utah?
Well, so
that is quite a move.
Yeah.
It is.
Really cliche. I followed a boy. My boyfriend moved out here after our undergrad, and then we did long distance during my grad school time.
It's never always great.
No, but it was, we got to learn ourselves as individuals during those years.
Yeah.
So then coming out here, that was always the plan after grad school, is to move to Utah since he was out here.
And he wanted to move to Utah.
He did. He's going to hate me for saying this. He had like a poster of Utah in his in his room. Like he manifested Utah for himself.
That was his
awesome.
vision board. Awesome.
Yes.
You know, people like it here. You know, some people more than others.
Yes.
But so pediatric physical therapy.
Yes.
Why did you choose pediatrics?
Well, so I guess starting from the very beginning, why I chose physical therapy is I played soccer, and like many athletes, I got an injury, and so I had to go to physical therapy. And I really enjoyed that. And I always knew I wanted to be in the healthcare field. I always, soccer, I was the one with the first aid kit in my bag, always giving people Band-Aids and ice packs. And then I always worked with kids. So I was always babysitting. I was a camp counselor. One of the families that I babysat for, they went to a pediatric clinic, and they were like, hey, you want to get some observation hours, see what it's like. You're really great with like our girls. Let's see how you like working with other kids. So I did a lot of shadowing time in high school at a pediatric clinic, and I loved it. My why story is we were working on gait training with a kid with cerebral palsy, and they would only walk if we played Taylor Swift. And I was like, this is my place. This is where I belong.
I belong in this setting. Yeah.
Yes. So that was why I chose it. And I feel like I've been on pediatric physical therapy for a long time now.
Yeah. And I think Taylor Swift would be happy to know that she's getting people moving.
Yes. She's an inspiration.
Just for people that don't know, do you want to explain what gait training is?
Yeah, so gait training is just working on walking. A lot of kiddos with certain disorders or certain things have those delays that impact their ability to move. And one of them is walking. So what we would do is we put them in something called a gait trainer. It's kind of a contraption with 4 wheels, and it's got some differing levels of support. And so we would put them in that, and that just helps them become more independent with their mobility, and exploring their environment. So that's what gait training is.
So every time I come up to Ogden to film with you, I feel like you're always with a baby.
Yes.
Right? You see a lot of babies.
I do.
So do you work on is gait training a pretty common thing for babies that are starting to walk, or maybe a little bit too late to the walking game?
I mean, a lot of those babies they see, it's Torticollis, which is a deficit in one of our neck muscles, kind of like a tightness on one side that leads them to looking. But I do see just global developmental, or I guess gross motor developmental delays. And so it's like if we're not walking around, 16, 17, 18 months, that's when they would come into physical therapy and we'd work on those walking skills. And it can be for a lot of different reasons. We have one of them can be motivation. We're faster when we're crawling than when we're walking. And, we want to get to where we want to go as quick as possible. But a lot of it could be just like our stability, balance.
Maybe they're scared of toddling. They've fallen once and they're like, that's not for me.
Yes. Because, it is scary. Every time you try something for the first time, it's scary. And working with kids, you kind of have to understand they're trying walking for the first time. If, you tried something for the first time, it's reasonable to be scared.
And does PT deal a lot with like the sensory stuff, or do you more let the occupational therapists handle that?
I think I use it for some of my kids, because for some kids that we do work with, the sensory component is important to do before we get into the gross motor component. So for like our toe walkers, they have a tightening of the calf muscles possibly, but the root reason behind why they're toe walking can be a sensory component. So you have to get down to the root of why they're doing it in order to address the physical components that come with it. And for some other kids, like our kids with autism who are sensory seekers, like you need to give them that sensory input in order for them to regulate themselves and to be able to focus on some like the tasks that I would like for them to do. So I work with the vibration board a lot of, giving them that sensory component of that, but then we'll go on that and then we can kind of target and funnel our attention to another thing.
Probably I would say the most common, you can correct me if I'm wrong. One of the most common things that our pediatric physical therapists deal with is toe walking, right?
I would say
one of them.
Yeah, it's pretty common. I feel like I don't go a day without a toe walker.
Yeah.
It's kind of like a cause and effect. So it's like we don't like the way the carpet feels on our foot, or we don't like the input that we're getting. So we go up on our toes. And if we're on our toes for prolonged periods of time, then our muscles are put in that shortened position and they stay in that shortened position if we're never being put in a lengthened position.
Right. Like we've taught our muscles to do that, right? And so then when you've done something like that for so long, then it just feels normal to always be up on your toes. Yeah. And then you wear high heels when you grow up, right? Yeah.
I don't know if you remember this, but we got a comment on one of our videos a long time ago, and we can cut this out if we don't want to talk about it. But I did want to bring it up because I thought it was interesting. There was a guy who had said that he had been toe walking for 30 plus years or something, and there was nothing wrong with him and he was totally fine. So like, what would you say to something like that?
Well, I think what I told you is like, okay, like nothing's going on. That's great. But for some kids, it can impact their functionality in society. And so maybe we're falling down the stairs all the time because we're on our toes. Or a lot of the kids that I see for toe walking, they participate in extracurricular sports. So, playing basketball through the schools or playing soccer, and parents are like, they just get way more tired, like because of the fatigue of always being on our toes. Or it's like they're doing these agility drills and they can't keep up with their peers. Sports specialization has gone really like big in the past few years. And so the emphasis of putting kids in higher level sports at younger ages is big right now. And for kids that are toe walking nowadays, that's where you kind of see that gap in ability to participate. Whereas, 30 or so years ago, sports specialization wasn't as big. And so being able to perform at a higher level at a younger age, you won't see as big of a gap.
Well, and I also think too that a lot of times there's just like this thought that if you can't do something that you used to be able to do, then you should get back to that. Largely, that's what rehab is about. But I always watch like the little kids that we work with and how they're able to squat all the way down to the floor and keep their heels down when they do that. And I know that that's something that I've lost. And it looks so fluid when the little toddlers and stuff do it. And I just think like, I know that I am probably working my body more just to get into those positions than they are. And they just naturally go into those positions. And I think if I had better range of motion and maybe softer muscles or muscles that were able to do that full range of motion, I'd probably move a lot better, just like those kids that I'm watching. And so maybe it's not necessarily that something is wrong with toe walking, but you're limited in a way.
I don't want to speak for occupational therapy and speech therapy, but physical therapy is all about like the participation aspect. Like, can you participate in your life? Can you participate with your peers? And so that's where what we're working on with the kids is being able to participate to your fullest potential.
And do everything that you need or want to do, right? Yeah, that's powerful. And I think that physical therapy, especially for kids, I mean, we work with a lot of the same kiddos back and forth, right? And there's a lot of overflow between our two disciplines or our two professions. What would you say is the biggest difference between occupational therapy and physical therapy?
We can go into like the whole gross motor versus fine motor aspect of it. And so for occupational therapy, we may be working on, tying your shoes or putting our shoes on. For physical therapy, it's like, let's try standing on one foot so we can get the shoe on, or, putting on our pants and like buttoning our pants. Well, for PT, like we focus on, can we balance on one leg so we can put the pants on the one leg? And then it's like you're working on school skills, and we're working in occupational therapy, or, those dining aspects. It's like, can we physically get ourselves from where we are to the school? Like how are we limited in the travel from our home to school? So I feel like that's like what I think about when I think of the differences between like OT and PT.
That's kind of what I have in my mind too, is that physical therapists are largely focusing on the ability and all of the factors that go into that, like strength and fluidity of movement or things like that. But more so, can you do what you need to be able to do, right? Mm-hmm. And that's why we need both disciplines, is because physical therapy goes to a certain extent, but then after a while, they go off and kind of in their own direction, right? And I think occupational therapy, we go in the same direction for a while, and then we veer off because we're more looking at the actual activity or the actual like not ability, but the actual like occupation, we call it an occupation, the actual occupation that's involved and being able to do that. And we might veer, for example, like off on a different route because you need to be able to do the activity, but in a different way.
Yeah.
Like we might adapt. I would just say making an adaptation to whatever they're doing so that the end goal is, can they do the occupation in any way, shape, or form? And that's where I think I distinguish it in my mind, but it sounds very similar to what you said.
We did want to transition, and I talked to you a little bit about this, is you just went through a really cool, was it like a training or something?
It was like continuing education. So
okay. Do you want to just talk a little bit about this training that you recently went through, which was concussion treatment, right?
Yeah. So, I mean, a little backstory. I got my first concussion when I was 12, so I was still a kid. Got my second concussion about 6 months after that, and then my third one about a year after that. So 3 concussions, all under the age of about 14. Never was recommended to go to physical therapy afterwards.
They never even thought of that back then.
No. And so as an adult, I still have some lingering symptoms and stuff and things like that going on that kind of can affect day-to-day activities. And so when I went into physical therapy school, we, learned that concussions are something physical therapists can treat. And it's a very common thing that we can treat. And it's a really important thing that we can treat because concussions can also be called minor traumatic brain injuries. Right. So they are classified as traumatic brain injuries. And I don't think a lot of people recognize that is what it is. It's like, oh, you bumped your head, you'll be good in a couple of days, sort of thing.
Yeah, mostly I think because it's a very common thing too, like football players, especially kids, soccer players, they all get concussions at some point. And so we've kind of normalized it to an extent.
Yeah. And so once I realized that was something that I could treat, it was something I was really interested in continuing my education on. And so for physical therapy, where we come in is when we are past those 7 to 10 days that it takes for recovery. So if we're still having lingering symptoms after, 2 weeks, 3 weeks, 4 weeks, you're still having symptoms that are, for kids, not just impacting your ability to go back to sport, because I feel like concussions in sports are pretty commonly linked, but also your ability to go back to school. Like, can we look, everything's on like computers and smart boards and things like that. So it's like, can you look at that without getting a headache? Can you read your required reading for school without getting a headache, without getting brain fog, without feeling these symptoms? And so for physical therapy, we come in and we can evaluate all of these different things that go into what a concussion impacts. So we look at your vision, we look at your balance, we look at your vestibular, which is kind of the inner workings of your ears that go along with balance. We look at your strength. Whiplash and concussion are kind of go hand in hand. There's actually like more G-force with a concussion than with like a 30-mile-per-hour car accident. And so and then we'll also look at exercise intolerance. So how did your body react to this concussion, and how can we get you back to sports? Because a lot of times you'll see dysregulation with our blood pressure and our heart rate and just a general fatigue. You can't go for more than 10 minutes of just light walking without getting symptoms. And so for PT, that's something that we can address, we can evaluate, we can treat.
If a parent brought a kid in for like a free consult for that, would you be able to, discover some of that like within the consult and say, this is what I think is going on with your child and this is how I can help them?
A lot of a consultation, we give the tour of the space, but it's also subjective stuff. So just learning from the parents being like, yeah, like they bumped, like they got in a collision at soccer practice the other day and, they've been complaining of a headache, or they've been avoiding doing their schoolwork, or they've been nauseous, any sort of symptoms like that the parents relate to me or the kids themselves relate to me. That kind of gives me an indication of like, we should probably look at some of these components just to double check that we're firing on all cylinders.
Like you said, to your own personal experience, that you had your first concussion and then your second and then your third, all under the age of 14, right? Yeah. And it makes me think like, I don't think that was something that we knew back in my day either, that it's a lot easier to get a concussion. Like you're more susceptible to even the signs and symptoms too that happen with a concussion. You're more susceptible after your first one. Like once you've had a concussion, like more things can go wrong because repeated injury, right?
Yes. Yeah. And so there's so much research out on concussions and athletes with concussions and young athletes with concussions. There's disparities between genders. So like with women, they tend to experience higher level symptoms, more anxiety, signs like that with repetitive concussion. So it's like once you get one, it doesn't take as much of a force to get those subsequent concussions.
So what are some of those things that you do in the clinic to help treat concussions? If someone comes in and they've had a concussion, what are some of those activities?
Yeah, so I can kind of give you maybe like one example for each of the kind of 5 areas that are involved. So if they're experiencing some vision symptoms, we can work on, Brock string exercises are big. And so working on our convergence, can we move our eyes in and out at the same time? Do they work together? Are they able to work separately from each other, but in a kind of typical manner? For vestibular exercises, we work a lot on, unfortunately, for vestibular exercises, it's like, oh, what provokes your symptoms? Great, let's do it again, sort of thing. So it's like a lot of focusing on an object while we're turning our head side to side or up and down. kind of getting our balance system a little bit more regulated. For balance, we work on single leg balance activities. We can work on, walking on a balance beam if that helps, standing on one foot on a foam pad. And we can progress that even to like, okay, great, you're good at that. Let's do our vestibular exercises where we're focusing on one target with turning our head while we're standing on one foot on a foam pad. There's ways to combine it. And then our strength. So our neck strength and neck pain and things like that, we can do manual to relieve some of that tension in the neck and those muscles. We can also work a lot on proprioception because when you have whiplash, you lose a little bit of proprioception. So people are like, where is my head in space kind of thing? And so working on just like doing like isometric holds, as well as like getting back our range of motion. So going as far to the side as we can or far up and down as we can. And then exercise intolerance, we kind of find their target heart rate using something that's called the Buffalo treadmill exercise test. We'll find that target heart rate where our symptoms aren't too high, but it's slightly provoking. And the recommendation is doing 20 minutes of exercise 6 days a week of like cardio. So walking on a bike, something like that, where you're roughly around your target heart rate. Every, couple of weeks, you reevaluate to kind of adjust your target heart rate. And that's kind of the progression for exercise intolerance.
That is just so wild to me that a concussion like affects all of that, So it's like the one takeaway I'm getting from this is parents, make sure you're watching your kids because these things are pretty serious and they come with a lot of consequences. But thankfully, like there are things you can do, to help mitigate that and help that. So yeah, thanks for sharing your little concussion journey with us. We appreciate it. So you came to Utah, and how did you end up with Ability Innovations?
So I was in the throes of studying for our board exam, which is so fun. Kind of having just a bit of a crisis of I'm moving to Utah. I don't have a job lined up. I'm going to be a freeloader at my boyfriend's apartment, basically. So I was Googling, and I honestly, you don't know this, but we had a assignment for a class in our beginning of our third year of writing a sample cover letter to like a potential employer, kind of just practicing those things. And she was encouraging us. She was like, find a place that you actually want to apply to. So I wrote a cover letter to Ability Innovations. Oh, wow. Never sent it.
So you found us like way before.
Yeah. So I found you guys way before. And I was like, in the back of my mind, I was like, okay, this looks really fun place. I love the interprofessional aspect of working with PTs and OTs. And then so I looked and around study. So a few months passed. I finished my full-time clinicals. I looked at the website again, and I saw that a current PT or I guess she's now no longer working here, but she graduated from the same grad school program as me. And I was like, okay, connection. So I sent in my resume and things to Des, who works for us. A few weeks later, I received a text message from that PT, and she was like, hey, do you have time for a call? And we chatted, and she kind of explained the situation to me. And I was like, yes, any hours that I can take, yes, please. I will take it. I have known I wanted to be a pediatric PT since I was 16, please. Then I moved out here and got the job. And
yeah, the rest is history, right?
Yes. So long history.
When it comes to Ability Innovations, we always pride ourselves on being a play-based, child authentic therapy clinic, right? Is that something that stuck out to you? And if you could, how would you define what play-based therapy is versus traditional physical therapy?
I mean, traditional physical therapy, when you think about it from an adult perspective, is sets and reps, sets and reps, sets and reps. And we kind of that doesn't exist in the umbrella of pediatrics, but specifically in play-based. I call it the kid has autonomy. We give the kids autonomy to pick what they want to do. I always say, I'm as a PT, I kind of just throw obstacles in their way for them to achieve what they want to do.
You're a great saboteur.
Yes. So it's like, oh, you want to play with the air hockey table? Great. We're going to stand on the Bosu ball while you play and challenge your balance. Or, oh, you want to play with this board game. Okay, well, the pieces are on the other side of the balance beam. We have to cross the balance beam in order to get the pieces to continue our board game. I think that's kind of how PT plays into play-based, but it really is just child-led. Like, I'm not the one being like, okay, we're going to play this and we're going to do this many times. I mean, for some of our older kids, that works better. But especially for the younger kids, I'm like, oh, okay, we're playing with Legos now. Okay, now we're going to go across the hurdles and go play with the bikes now, sort of thing. So it's really just follow their lead, quick on your feet.
Yeah. When it comes to like the whole child-led thing, I think it's super interesting. And I was talking with Nick and Haley about this today, and even you a little bit when you showed up. I think the PTs work really hard here. Like every time I go and film with you guys, it's like we're in one room for 5 seconds, then we're in another room for another 5 seconds. Is a lot of that intentional, or is it just up to the kid?
I mean, it is intentional. So a lot of like play-based and a lot of play is like, oh, let's play tag. Like, let's run, like running here. Like, oh, you got me. Okay, you have to run away from me. That's play, but we're also working on endurance and working on our running mechanics, and we're working on our, quick stops and starts with running and changing directions. That, at least from the running perspective, is, that kid wants to do it, but it's also works for their goals and works for what we want to do with them. Like a lot of it too is like we do a good amount of heavy lifting, with getting, especially with our more involved medically complex kids. It's a physical therapy. It's a physical job.
I think it can be what you make it to. I mean, we're not sedentary at work at all, right? There's always something that we're doing, and we're probably burning a lot of calories throughout our day. And I think that, it hones itself to what is it that kids are really going to do for their physical therapy needs. Like if you sent them home with reps and stuff like that, they probably, they wouldn't internally go, oh, I need to do this and I better do it. They would have to have a parent telling them, and parents are busy. So they're not going to be able to always be after the kid like, hey, do your physical therapy exercises. If we are able to work with kids and get them to do things, but do it in a way that's a little bit more taxing or really stresses their balance or things like that, then hopefully when parents see us do that too, they'll be able to be like, oh, let's do this, but maybe on your little balance board or things like that at home as well. So they're keeping those skills going and working on their physical therapy needs, kind of like we do at the clinic. Yeah. That's the idea, right?
Exactly. And I feel like too, with a lot of PT stuff, like what comes to mind is, hopscotch.
Yeah.
Like that is,
it's got a lot of skills in it.
Yeah, so many. Like agility, coordination. We're working on strength and balance if we're including like a one-leg hop. And then sometimes I'll be like, oh, we need to work on jumping jacks, but I can't just tell a kid to do a jumping jack. Like that's no fun. So I'm like, okay, let's do hopscotch and include butterfly arms with it. And like we can coordinate our arms and legs. And they're like, oh, I'm butterfly arms hopscotch, but we're doing jumping jacks sort of thing. So it's just, it's just stuff like that where there's definitely a creativity part of it. But knowing how kids play is super important to achieving their goals in physical therapy.
And super relevant for them. Mm-hmm. Yeah, I love it.
Do you have any like inspirational stories or like favorite moments that have happened to you since you've worked here?
I had a kid yesterday who I've been treating for months. Came in walking.
Oh.
Yes, for the first. Mom said they started doing it on Sunday. Came in walking. Yeah, me and Mom did a little happy dance together. We were so excited because we had been trying to get them to walk, and they started walking.
And you think to yourself, like, oh, maybe that's just, like they're growing up. But they're growing up with all of this input that we've been giving them, that you've been working on with this kid. And now they feel like they can do it and they're running, well, not running with it literally,
Walking
with
it.
it now soon.
Yeah.
Maybe one day they'll be running with it.
Yes.
Yeah, maybe soon.
Yeah. So that was like first thing that comes to my mind with that question is it's just a very exciting moment because we've been working on it for a while.
I interviewed a parent of one of Liz's kids that she works with, and he has cerebral palsy. And I think it was his grandma that I was talking to, and what she said is she just said like when they first started seeing all the symptoms and stuff at first, it just broke their heart. Like, how could this happen to him? Like, he's such a good kid, and what can we do to help him? And then taking him to Ability Innovations, like just really enlightened their spirit and really taught them like he can do these hard things. He's not going to be 100% normal, quote unquote normal, but he's going to be able to accomplish difficult things. And it's because of the therapist here. And she was just so grateful for like Liz. And I think Emily was his occupational therapist as well. But she was just super grateful for that. And I hope that like all of our therapists here realize like the impact not only they have on these kids' lives, but like the guardians, the parents of these kids, because they see these results and it just makes them feel so good about it.
Another one I think of is, I have a little kid came in with kind of developmental delay. We weren't sitting at the right time. Not right time, but the typical developmental milestone time. And we were doing some little interesting army crawling going on. Every few days, mom will message me and be like, they were on hands and knees. They were on hands and knees and crawling forward for a little bit. Like they did this. And then so like that's always so exciting that, I've been seeing this kid for a couple months, and it's, I am a member of, this kid's journey with their developmental skills. I'm involved enough that mom, feels comfortable and is like excited to text me when this kid has these goals and like is making these moves. And so I think that's another story where I feel like, you build these relationships with not just the kids, but with the parents as well. And so you
become part of their inner circle and they're sharing milestones and pivotal moments with you.
Yeah. And it's like we're celebrating birthdays with each, like, we're like, yay, like we're 6 years old now. Like that's just exciting.
Yeah. So you've been in other physical therapy clinics and even adult ones.
Yeah.
And how would your job be different if you had to see a pediatric patient, but in an adult facility?
One, not all physical therapists have a passion for working with kids.
That's true.
So there are physical therapists. I mean, in my class who were like, if a kid came in to see me, I wouldn't know what to do with them.
Nope.
Yeah. And I mean, that's totally valid. Like that's, not what they would like to do. Like not the people they want to work with.
And maybe that's why they're in an adult clinic.
Yes. Yeah.
They choose to work with adults. Yeah.
Yeah. But so a kid going into an adult clinic with a random physical therapist, I mean, you don't really know. Not a lot of adult physical therapists too know in depth about child disorders. So, if they're going in with an orthopedic condition, like, oh, we sprained our ankle or, we have Osgood Slaughters in our knees, that's a bit different, I would say, in terms of treating the diagnosis. But I think a big part about pediatrics too is like treating the kid. Like you have to know how to interact with kids and build that relationship with kids because they're not easy to, not quick to trust.
Right.
So you have to build the trust of the kid and the parent. And if you, know how to treat the condition, but don't know how to treat the kid, that can create, less progress.
Non-compliance and all of that. Yeah.
And general adult clinics, they're not going to have a lot of the fun games that we have here. Like we have board games, we have card games, we have a slide, we have a ball pit. Like those are all fun things that we can incorporate into our therapy sessions. at an adult clinic, you're going to have weights and you're going to have therapy bands.
They might have some of those little games.
Yeah, but it's just not
limited.
Yeah. So it's like the kids don't have a huge, variety of choices to make. You're probably going to be playing with the same thing every week.
We disguise that boring stuff with fun stuff.
Yes.
Is what we do here.
Yes, exactly. So I think that's like the big difference between like going to an adult clinic as a kid versus coming to a specific pediatric clinic is they're just not going to have the stuff targeted towards kids because their treatment population is much broader. So you have to accommodate all of your treatment population.
Right.
Whereas, for us, our treatment population is 0 to 21. In an adult age clinic or a regular outpatient orthopedic clinic, you can treat 0 to 100.
Yeah.
So.
Well, it's probably easier to tell an adult, like, do this many reps, like 3 times a day or whatever. You tell a kid that, they're like, what is a rep?
Yes.
Right? And why do I care?
But yeah.
Well, and I think even like some of those orthopedic injuries, like, hey, I broke my arm and I'm trying to get it back into doing what I needed to do. And if they came here to Ability Innovations, they would be doing vastly different activities and lots of different methods and lots of different like focuses in different areas on what they're able to do versus if they went to an adult clinic, they are set up for things like upper body exercises and they've got the weights and the TheraBand, but we might do that here in a way that's more attuned to that kid than the actual exercise, right?
Yes. And I think it also comes back to like the play-based is, we have the tools and the resources here that cater towards play, which is what that kid is trying to get back to if we're using the broken arm example. They're trying to get back to going to go play with their peers and play out in their environment.
Play a sport.
Yeah. Whereas in like a general orthopedic clinic, there's less resources for play.
Well, we're going to wrap things up, but I do have one last question, and it's what we ask every single person that comes on the podcast. And that's, since we are like superhero themed here at Ability Innovations, we want to know, what is your superpower?
I think my superpower could be just my never-ending curiosity. I think I'm a really curious person, and if I don't know something, you can bet I'm looking it up to find the answer. And I think that really helps me in this field, particularly because we're lifelong learners, as I think all humans should be, but especially in the healthcare field, the amount of research that changes between in our careers. Year to year is just wild. And so I'm always, looking at that research, looking at some things, and even like, I'm like, oh, what is this? Like, I'll look it up. Like I love learning what things are and I love knowledge, and it's just really helps me, I feel like, be the best practitioner that I can be, but also just the best person that I can be.
They say like knowledge is power is like super cliche, but it's very true, like especially in this career field. Well, thank you for joining us on this podcast today. We'll go ahead and wrap up today. So thank you for joining us for Therapy Unmasked. Again, we had Morgan. She is a pediatric physical therapist here at Ability Innovations. Therapy Unmasked is brought to you by Ability Innovations. Feel free to check out our website, www.abilityinnovations.com, for lots of free resources. We have tons of great blogs and articles and also podcasts. And Morgan actually just wrote a blog. We just published it a few days ago on stair climbing, right? Climbing stairs.
Stair navigation.
Stair navigation. So, and she does a really good job. She breaks down the time frame that you should be looking at for your kid when they should be crawling up the stairs versus walking up the stairs with holding onto the rails versus just walking up the stairs naturally and coming down. So she breaks all that down in her article, and there's tons of great blogs by all the therapists here on our website. We also have tons of great podcasts that you can listen to. Nick started this as a resource for parents to help you guys be able to have the resources and the fellowship that you need to help your kids reach their goals and reach their milestones. And if you feel like you need your kid to see more progress than they're seeing at home, feel free to reach out to us for a free consultation, and we can get you all figured out and see what's going on with your kid and how we can best help them. So again, this has been Therapy Unmasked, and we'll see you in the next one. Bye.
Bye.
Goodbye.